Okay, welcome back to the fourth video in our diabetes lecture series. And we're going to start here on nutrition therapy and diabetic diet. And this is a very important aspect of diabetic care. Now, in the old days, they paid particular attention to what we called an exchange system. And this was kind of an archaic system. It was very, very hard for a lot of diabetics to follow the system, and so therefore a lot of diabetics were non-compliant. How the system was set up was each food item was um, based upon 15 grams of carbohydrate. That's because 1 unit of regular insulin is equal to about 15 grams of carbohydrate. And so they took all the different food sources, they divided them up into 15-gram increments, and they said, okay, this is the exchange system, and if you don't want a potato, then you can have an orange or you can have some pasta instead. And so it was very complicated. And let me give you some examples of 15 grams of carbohydrate. One orange is equal to 15 grams of carbohydrate, and that's equal to one banana, and that's equal to 1/2 cup of pasta. That's equal to 1 cup of milk, or one slice of bread, or 1 tablespoon of sugar, or one apple, or 4 ounces of orange juice, or a half of a hamburger bun. And so you can see that this system got real complicated, and most hospitals and most diabetics that I know of don't use this exchange system anymore. There was also a time when they in their diabetic diets, they had like 1800 ADA diet and 2400 ADA diet. And what those numbers meant would be that the dietitian sat down and figured out how many calories that diabetic person could eat during the day. And let's use the example of 1800 ADA diet. That dietitian figured that that person could have 1800 calories. They would divide that by the 3 meals and the snacks, and they would give them an appropriate diet in exchange. And so that also was pretty tough. But some hospitals may still use that. Instead, nowadays, what most dietitians will recommend would be that the diabetic patient will consult the diabetic education nurse and the registered dietitian. They will maintain day-to-day consistency, try to stay away from concentrated sugars, try to follow the food pyramid, and that's a pretty good diet for a lot of diabetics. And so just like we said, a lot of hospitals may not use the diabetic diet or ADA diet or exchange system nowadays, but instead they'll usually have them follow a food guide pyramid. They'll recommend them to stay away from concentrated sugars. They'll try to maintain day-to-day consistency in their diet. And what this means is one day you're not going to claim jumper and getting like 2,400 calories in one meal, and then the next day eating a small salad that has maybe 500 calories in it. So if you can eat the same amount of calories each day, it helps to regulate their blood sugar levels. They also recommend that they have adequate protein so that they don't have muscle wasting. And often a lot of doctors will recommend about 20% of the calories will be in proteins. Usually about 50% would be in carbohydrates, and to make sure that less than 30% of the calories are in fats. And if the person has cardiac issues, then a lot of times they're going to try to decrease the amount of fats even more, especially the saturated fats. And then the rest of the diet, they encourage them to eat fruits, vegetables, and fiber. Okay, now the last time I was at the hospital, I saw the diabetic education nurse use this method of teaching the diabetic patient, and this is probably the most recent, the most common one that you're going to see nowadays. And what the diabetic educator is going to do is tell the person to divide the plate in an imaginary half, and then the 1/2 in half again. And on the side of the plate where it's half, you fill that up with low carbohydrate vegetables like broccoli and green beans and cabbage and cauliflower and stuff like that. And then on the other side where you have 1/4 of the plate, that's where you're going to fill that section with lean protein. something like baked chicken, fish, pork, something like that. And then the last 1/4 of the plate, this is for the carbohydrates. And usually what they recommend is a healthy carbohydrate, something like brown rice, sweet potato, whole wheat bread, not a like a processed white wheat, but something that's a complex carbohydrate. And then a lot of times in a diet too, they will let them have 1 glass of skim milk and then often a small piece of fruit or maybe some yogurt. And that is a very, very common diabetic diet. And it's one that you see most diabetics encouraged to follow nowadays. Now, here's an example of non-diabetic diets. They look great, and most of us like to eat this stuff, but if you're diabetic, this is not going to help you at all. There's too much fat, too many carbohydrates. It's just very hard on your diet, and it would cause their blood sugars to go up sky high. And so these are examples of non-diabetic diets. Now this one here, these are good diabetic plates. You can see that there's a large portion of vegetables, lean meats. They're controlled. They don't have just heaping amounts of fats and carbohydrates. And so these are very good diabetic diets, examples of that. And then in summary for the diet, like we said, half the calories should be from carbohydrate, and it should be a complex, healthy carbohydrate. 1/4 of the plate should be, the protein, and it should be about 20% of the calories should be from the protein, and make sure that's less than 30% fats, and then the rest would be your vegetables. And it's real good to encourage diabetic patients to stay away from concentrated sugars and stay away from saturated fats and stuff like that. And so that's a good diabetic diet. Now this slide here, it talks about exercise therapy, and exercise is very, very important for all of us, but especially a diabetic patient. The benefits of exercise, it's going to cause them to it's going to lower their cholesterol levels, triglyceride levels. It'll help regulate their blood pressure and bring it down. It'll burn up extra glucose that they may have. And it makes the insulin receptor sites more sensitive to the insulin that they do produce. So it's very important. Now the side effect of exercise would be hypoglycemia. So if you exercise too much and you don't eat enough food in response to that, the patient can become hypoglycemic. And so at this point, you want to teach them about the side effects of hypoglycemia and the signs and symptoms. And so a little saying that we use is, cool and clammy, give some candy. And so if they get kind of cool and diaphoretic and a little bit dizzy and stuff like that, it usually means that they're becoming hypoglycemic. They should stop exercising at that point, sit down, and hopefully get some type of calorie into their system. Now, things that we want to teach our patients about exercise, they should check their blood sugar before they go and exercise, and it shouldn't be too high or too low. If it's too high, then they need to take a little bit of extra insulin to bring it down to a normal range. If it's too low, then they need to eat some type of food to bring it up. As they exercise, they should always wear a medical ID band that states that, I'm diabetic Diane, I'm diabetic, this is my doctor's number, this is my medical record number, and in case, they pass out while they're exercising. They should also be encouraged to wear proper footwear. What this means is that the shoes should fit very well. They shouldn't be too tight, too loose. We don't want their feet to get blisters. We don't want them to go barefoot. So it's very, very important for them to examine their feet daily. And if they can't see the bottom of their feet, then what they need to do is to sit down and have some kind of a little mirror down on the floor, and they can look at the bottom of their feet through the mirror, or have another person check their feet. And it's very important they do this daily, because any little cut in a diabetic person's foot can lead to the loss of toes and their foot because they can't fight infection as well. And so it's very important that they check their blood sugar, they examine their feet daily, and they do all this before they go out and exercise. Okay, now this slide talks about surgical management. Now, we talked about diabetes as an autoimmune disorder where the body wipes out the beta cells in the pancreas, and this person's never going to produce insulin anymore. The only remedy would be either to give themselves insulin each day, or if they were to receive a transplant. And if they are fortunate enough to get a pancreas transplant, often they have to wait on a list for years and years. Often nowadays they will give them both a kidney and a pancreas transplant at the same time. Now you may ask, why do they need a kidney? Whenever we give a patient a organ transplant, they have to give them anti-rejection drugs or they will reject that organ. And probably the most common anti-rejection drug that we give today is called cyclosporin, or Sandimmune is the other name for that. And it's a very, very common medication so that their body doesn't reject the organ. They have to take it daily, or else they'll lose that organ. Now, the reason why they need that kidney is that cyclosporin is very nephrotoxic. And what that means is if they don't have a good kidney that's working, then the organ won't take. And so they have to have at least one good kidney that will help them to rid the drug from the system and for the pancreas to take. Okay, and then the last little bit of this video, number 4, we're going to talk about patient education. And these are the things that you want to teach your patient before they go home. So number 1 talks about demonstrate blood glucose monitoring. Now it's real important that we teach our patients how to do this properly. And I don't know if you remember back in the first part of the school, how we taught you guys how to check their fingers, rotate the sites, clean the side of the finger with alcohol wipe, to poke the finger with the lancet, to put it in the machine, and to read what their blood sugar reading is. And so we want to teach the patients how to do this. And at first we may want to do it for them, and then as they get more and more comfortable with the equipment, then what we want to do is give the equipment to them and watch them just to make sure that they can demonstrate that they're doing it properly. And number 2 talks about demonstrating how to administer insulin. And just like we taught you guys, this is what we want to teach our patients. So they're going to be taught how to check their blood sugar level. Then with that number that they receive, they're going to look at the sliding scale, and the sliding scale is going to determine how much insulin they need to administer to themselves. And we're going to teach them to do this AC and HS before breakfast, lunch, and dinner, and at bedtime. And if their blood sugar's high, they look at the sliding scale, they determine how many units to give, and then you're going to teach them how to draw up the insulin. If it's like NPH, we need to roll the insulin before we draw it up, and how to pick sites and how to rotate those sites. And so all that stuff that we taught you guys in class, you need to teach your patient. And there again, the best way to help them would be to have them demonstrate that they can do this properly. Okay, so we want to also teach them the relationship between diet, exercise, and insulin, just like we talked about a few slides ago. We want to teach them the signs and symptoms of hypo and hyperglycemia, and we'll talk more about this in just a little bit. But for example, hypoglycemia, the little saying that we use is cool and clammy, give some candy. And for hyperglycemia, it's hot and dry, sugar's high. We want to teach them about what to do on a sick day. So a lot of times if someone is not eating as much food, then a lot of times they may not need as much insulin on those days. Number 6 talks about we want to teach them personal hygiene, so foot care, skin care. Number 7 talks about you want to discuss the complications of diabetes with them. And remember, the better you keep your blood sugar under control, the less complications you're going to have. We also want to teach them about regular medical care and also community resources like the American Diabetes Association.